Resting heart rate is one of the simplest yet most powerful indicators of overall health. It reflects how hard your heart works to keep your body alive and functioning when you are completely at rest. Many people hear numbers like 60, 70, or 100 beats per minute and wonder what they really mean. More importantly, they often ask when a resting heart rate becomes too high, and whether it should be a cause for concern. Resting heart rate refers to the number of times your heart beats per minute while your body is relaxed, calm, and not engaged in physical activity. The most accurate time to measure it is early in the morning, right after waking up, before getting out of bed. At this moment, your heart is not responding to stress, movement, or digestion, making it a reliable snapshot of your baseline cardiovascular function. For most healthy adults, a normal resting heart rate falls between 60 and 100 beats per minute. This range is broad because heart rate is influenced by many factors, including age, fitness level, genetics, and lifestyle. Well-trained athletes often have resting heart rates below 60 beats per minute, sometimes as low as 40. This does not usually signal a problem. Instead, it reflects a strong, efficient heart that can pump more blood with each beat. A resting heart rate that consistently approaches the upper end of the normal range, or exceeds 100 beats per minute, may be considered high. This condition is known as tachycardia. While a single high reading is not necessarily dangerous, a persistently elevated resting heart rate can place extra strain on the heart over time. The heart must work harder even when the body is at rest, which may increase the risk of long-term cardiovascular issues. Several everyday factors can temporarily raise resting heart rate. Stress and anxiety are among the most common. When you are under emotional pressure, your body releases stress hormones that prepare you for action, even if you are physically still. Caffeine, nicotine, and certain medications can also increase heart rate by stimulating the nervous system. Dehydration plays a role as well, because reduced blood volume forces the heart to beat faster to maintain circulation. Lack of physical fitness is another major contributor. When the heart muscle is not regularly challenged through exercise, it becomes less efficient. This means it needs to beat more frequently to deliver oxygen and nutrients to the body. In contrast, regular aerobic exercise strengthens the heart, allowing it to pump more blood with each contraction and reducing the number of beats needed at rest. Illness and underlying medical conditions can also cause a high resting heart rate. Fever, infections, anemia, thyroid disorders, and heart rhythm abnormalities are all potential causes. In these cases, a high resting heart rate is often a signal that the body is under stress, or that something is not functioning properly. Ignoring this signal may delay diagnosis and treatment of an important health issue. What makes a high resting heart rate concerning is not just the number itself, but the pattern over time. A sudden increase from your usual baseline, or a rate that remains elevated day after day, deserves attention. Symptoms such as dizziness, shortness of breath, chest discomfort, fatigue, or palpitations alongside a high resting heart rate should never be ignored. Research has shown that a higher resting heart rate is associated with an increased risk of cardiovascular disease and overall mortality. This does not mean that a heart rate in the 80s or 90s automatically predicts illness, but it does highlight the importance of viewing resting heart rate as a long-term health marker, rather than a standalone measurement. Lowering a high resting heart rate often involves improving lifestyle habits. Regular physical activity, particularly walking, cycling, or swimming, can make a significant difference. Managing stress through relaxation techniques such as deep breathing, meditation, or mindfulness helps calm the nervous system and reduce heart rate. Adequate sleep is equally important, as poor sleep quality can keep the heart rate elevated even during rest. Staying well hydrated, limiting caffeine and nicotine, and maintaining a balanced diet also support heart health. In some cases, medical treatment may be necessary, especially if an underlying condition is driving the high heart rate. A healthcare professional can determine whether further testing or medication is required. Ultimately, resting heart rate is a quiet messenger of how your body is coping with daily demands. When it is consistently too high, it may be telling you that your heart is working harder than it should. Paying attention to this signal, understanding the factors that influence it, and taking steps to support heart health can make a meaningful difference in both quality of life and long-term well-being.